Hi, I'm Dr. Jared Nielsen here in Heber City, Utah. I'd like to talk to you today about the importance of hyperbaric oxygen therapy, or HBOT. If you have a specific interest or if you know of cases that have had an application, or maybe this is your first time even learning about hyperbaric oxygen therapy, there are some highlights on the screen that we'll have available for you to quickly fast forward to find in the video the area of interest that you may have. Hyperbaric oxygen therapy has been utilized for many, many years, primarily in post-diving incidents or accidents, specifically a condition called being bent or the bends. When we look at this, it actually is a compression chamber where your body is infused with oxygen to be able to help the lungs to recover and the bloodstream to recover quickly. What's interesting about compressed oxygen is the body itself can begin to absorb oxygen as well, and we get a hyperperfusion or a rapid recovery state of the body. And this was observed by the Navy divers over the years, that there was an application to actually helping the body heal from a post-injury or a hypoxic state. For example, a heart attack, a stroke, or some type of a trauma where there's been swelling to a region of the body. Rapid oxygenation actually increases the healing rate. So we look at then approvals from the FDA for hyperbaric oxygen therapy in particularly wound care for those who are diabetic, for those who've experienced strokes, and also hypoxia from elevation changes. A lot of people experience elevation or altitude sickness due to a lack of oxygen, and hyperbarics is one of the best things we can utilize to help a person recover from that type of lack of oxygen state. When we think about this, hyperbaric oxygen therapy utilizes again oxygen with compression, so we describe it as taking a dive, meaning it's a sensation as if you're diving in a swimming pool, and you know how you clear your ears when you go down into a deeper end of the swimming pool. Similarly, in a hyperbaric chamber, it has that sensation of an increased pressure as if you were floating or sinking, if you will, to the bottom of a pool to a deeper level. When we take the dive, we look at increasing again the oxygenation to the blood and therefore the delivery of oxygen to the entire body. This again increases the rate of healing, particularly now as we have an application for post-concussive injuries to the brain or post-traumatic brain injuries or TBIs, an application also of post-traumatic stress disorders for those who've been in the military and those who've experienced emotional traumas where the brain is very excited and a hypoxic state results. So if we experience consecutive dives, we actually see consecutive healing. One of the principal researchers right now in hyperbaric oxygen therapy is a Professor Harch. Professor Harch is in Louisiana, and he has done a great deal of research on the efficacy and the validity of hyperbaric oxygen therapy for a myriad of benefits and also cases that respond very well. So we're talking about, again, post-traumatic stress disorders, traumatic brain injuries, Alzheimer's disease, strokes, any type of a wound that needs to heal rapidly, including fractures and post-surgical applications. Post-surgical applications also including not just the orthopedic or the injuries associated with bones, but also plastic surgery or facial reconstructive surgeries. Dental applications where people have had grafting of bone or grafting of gum tissue. These types of cases respond very well to increased oxygen because, again, once we've had disruption of the blood supply, the oxygen needs to be reintroduced to those healing tissues. As we look at it, Professor Harsh has actually shown that when a person is in a hyperbaric chamber, the brain particularly and the body will release stem cells. Now, stem cells we've heard a lot about for their ability to actually differentiate and assist in healing, but particularly in the fetus or the embryonic states, in differentiating into new tissues or growing or maturing tissues in the body. Stem cells have actually been proven to be activated with just a single hyperbaric dive. Therefore, recurrent dives or a sequence of dives will actually create an activation for healing. This application is particularly effective then, again, for neurologic disruptions. Multiple sclerosis or Alzheimer's or degenerative dementias have responded well to hyperbaric oxygen therapy. When we see also then the value of stem cell activation, we look at more aggressive type degenerative diseases like Lou Gehrig's disease or ALS. Another one of the great researchers in neurologic disorders is a Dr. David Perlmutter out of Naples, Florida. Dr. Perlmutter is a medical neurologist who for years has been studying neurodegenerative diseases, primarily, again, Alzheimer's disease, Parkinson's disease, and neurodegenerative dementias. When we look at Dr. Perlmutter's work, he utilizes hyperbaric oxygen therapy, again, as a means of stimulating stem cell activation, also of being able to restore oxygen to areas that have become hypoxic or lost blood flow. So again, stroke victims respond very well to hyperbaric oxygen therapy. Dr. Perlmutter's research also in the utilization of glutathione with hyperbaric oxygen therapy has been a benchmark for actually helping people to heal. And you can often reference some of his older videos that show a patient who has Parkinsonism and the stroke or the lack of facial expression after being given glutathione injections, actually being able to have quickness in their movements, their ability to turn, and to have facial response or facial characterization. Very important, again, when we look at healing neurodegenerative diseases. When we look for the child with the neurodevelopmental delays, a child that may have cerebral palsy, a child who may have some type of attention deficit disorder, an ADD or ADHD, or even children with the Asperger's type syndromes, these children can respond very well also to the hyperbaric oxygen therapy, and again, something that Professor Harch references. Top performing athletes, those who haven't even experienced injury, find that hyperbaric oxygen therapy is a great way to recover and also to prepare for the next event or their participation or competition. There are several MMA fighters in the Las Vegas area who utilize the hyperbaric oxygen therapy both pre and post bouts to be able to recover and prepare for the fight. There are a lot of NFL players now who actually have hyperbaric oxygen therapy chambers in their own homes and have shown the validation and the need to be able to use oxygen as a means of recovery. So as we think about this applications, it's not only for injury, it's also to elevate performance. As we look again at the application for the student athlete, we've had a lot of young people who've experienced sprained ankles, sprained wrists or shoulders, post-surgical treatments where there have been fractures that have been plated or needed to have some type of a surgical stabilization. The hyperbaric oxygen therapy is a means to accelerate that healing. So we have lots of cases where we can actually validate the benefits there. As we talk about concussions and traumatic brain injuries, hyperbaric oxygen therapy is a rapid way of reducing the inflammation and restoring the brain's function after a concussive injury. People who have poor rest, so people who have sleep apnea, disrupted sleep, their brains aren't recovering during the night adequately, and hyperbaric oxygen therapy is a means where they can actually get that hot oxygen elevation to the brain to recover that metabolic state. The brain is very fascinating. In fact, a reference to a TED talk that was given recently is the brain utilizes the blood vessels to dive deep into the regions of the brain that need oxygen. And then during the night, in a rest state, the cerebral spinal fluid will follow the pathway of the blood vessel into the brain to draw out the waste in a resting state. So when we aren't resting or aren't getting adequate sleep, that congestion begins to develop in the brain that then creates more and more of the brain fog. So again, recovering the brain from a hypoxic state or a metabolic state or a lack of sleep would be benefited by hyperbaric oxygen therapy. There are many applications, and again, this is just an introduction, but as we begin one dive will actually change the brain's patterns. Professor Harch has some of those SPECT scans that can be viewed in his book that actually show a single treatment of the brain will actually change the responsive metabolism in the brain just by that one dive. A sequence in some cases for a more advanced injury may be required. I hope this is a help to you as you think about how to heal your brain, how to heal your body, how to perform better. Oxygen is essential. I'm Dr. Nielsen here in Heber City. I hope this is a help to you.